plans.
Thank you for your testimony. Debate on the bill as amended. I'm going to give you between just about 30 seconds to do a debate, so we have enough time. Yes, Representative Randolph.
Okay, well, in 30 seconds, I've seen some absurd bills in my time, but this has to be the highest. If you want to talk about affordability, okay, more Americans go into bankruptcy because of medical problems than any other area in this country. You want welcome card, an entry card to nothing. You get an entry card to a piece of nothing is what we're about to do in this state. And this is the classic example of corporate socialism. You are going to privatize the benefit of lower health care costs, and you're going to socialize the cost of all these problems that people have. You're going to put them over onto Medicaid. This is a huge increase in Medicaid. If you vote for this bill, this is saying, I want to increase Medicaid in this state. This is a vote to increase Medicaid and to drive people into bankruptcy. And we're going to rely on Doctors Without Borders for basic health care in the richest country and one of the richest states in this nation.
Thank you, Representative. Any further debate on the bill? Representative Boyd.
Thank you, Mr. Chair. Obviously, this is a very tough issue. I think as a public servant and as a proponent of limited government, I take what we do very seriously, and also public health and good is something I take very seriously. Clearly, there's some mandates that are issues that we ought to consider, some perhaps not, but I've talked with Chairman Wood about this. I have faith in the fact that this is a beginning of a discussion, that we're talking about where we go from here, what should we do as government, what we shouldn't. I've heard mandate light, mandate heavy. Those are some good concepts. So I'm in support of this today, but with the clear understanding that as we move forward, we need to make sure we're doing what's necessary in terms of the good public good as well.
And Representative Porth.
Members, please ask yourselves, who are we here to protect? Are we here for the insurance industry and their profit margins, or are we here for Florida's families, those that are most fragile and medically needy, those that are crying out for help? Members, it's Children's Week here in Tallahassee. I don't have to be reminded who I'll be siding with today.
Thank you. And I've kind of been holding back for a while myself, obviously, as the temporary chair. But this is a well-intentioned bill. We all want to save our taxpayers and our citizens money as far as their insurance policies. And we workshopped this bill. And when we workshopped this bill, I had a very important question. How much was each one of these mandates truly going to save the insured? What was actually going to save the insured? We were never given that information, about each one of these issues, because we should look at each one of these individual issues about a savings. That never happened. That never took place. Each one of these mandates is in statute for a reason. One of our citizens needed care, and they were more than likely denied by an insurance company in the state of Florida, and it was expected they'd have this care. And here we had testimony about disease states, children's deformities, things that you can't predict ahead of time, that you can't prepare. You can't purchase a rider before a child is born, before they have developmental problems or cleft palates and things like that. These are everything that's in this mandate is there for a reason. And with that, Representative Wood, I let you close.
Members, thank you for your attention to this important issue today, and I would ask for your favorable support.
I'd like to call the roll for the vote.
Representatives Ahern?
Yes.
Boyd?
Yes.
Ford?
Yes.
Gonzalez?
Yes.
Hudson?
Yes.
Jones? Nunes?
Yes.
Oliva?
Yes.
Forth? No. Randolph?
No.
Reed? No. Renuart?
No.
Rooney? No. Schwartz? No. Chair Wood?
Yes.
The bill passes.
With that, shows the PCB reported favorably as amended.